Good afternoon, everyone. My name is Ekaterina Menshikova, and today I will show you our presentation, which subject is Problem of Cybersecurity in Context of Medical Information System Register of Palliative Patients. We will start with the concept of medical information system. In modern medicine, information systems are used in all its most important areas, while much attention is paid to the collection and systematization of the versatile information. In the Russian Federation, the concept of creating a unified state information system in the field of healthcare was approved at the federal, regional, and health facility levels. Medical Information System is a software product for integrated management of all major processes related to the work of medical institutions. Medical information systems are one of the most sensitive to information security problems types of information systems. Currently, in our country, there is growing attention to such a specific area of healthcare as palliative care. Palliative care is provided to the seriously ill, including incurable citizens, in order to maximize their quality of life through medical manipulations and medications. There are at least 3 reasons to develop specialized medical information system for palliative care institutions. According to the World Health Organization, number of patients needed in palliative care increases every year. There is no unified system for recording patients who need palliative care in the Russian Federation. To provide high-quality palliative care, specialists monitor and evaluate many parameters which today, as a rule, are recorded on paper. The information system register of palliative patients is intended for storing and processing data of patients in need of palliative care in the Republic of Karelia. The system under development should carry out the following functions. System administration, which includes input, editing, and deleting data about system users and records in the reference books. Patient registry management, which includes input, editing, display, and search information about patient and patient prescriptions. Report generation, which includes statistical and prescription reports in PDF format. There are 2 categories of users, user and administrator. The administrator registers user doctors and accompanies various system reference books used for maintaining medical records and generating reports. The doctor registers patients and keeps their medical records. The external entities to which the reports are generated by the system are, for statistical reports, the Ministry of Health of the Republic of Karelia, for prescription reports, medical users. The general view of the information model of the system in the form of an entity relationship diagram is presented on the slide. The prototype of information system register of palliative patients has a classic web client-server application architecture. The diagram presented on the current slide shows the main software models that compose this system, and the relationships between them. As a method of user authorization, role-based access control was used. As a result of clinical testing at the Center for Palliative Care in Petrozavodsk, the system was recognized as fulfilling the specified requirements. The prototype of the system was recommended as a standard form of recording in all relevant medical institutions. One of the most important tasks in the development of medical information system is to ensure information security. At the same time, it's necessary to protect both personal data of patients, and information about the medical information system itself. Since in Russia medical information systems have the status of information systems for processing personal data, it's imperative for them to fulfill the information security requirements defined by special decree of the government of the Russian Federation. The decree establishes the levels of security of personal data that the information system of personal data should provide, depending on the significance of this data and its volume. The developing system belongs to information system of personal data of the third level of security. The level of initial security of the system was determined to analyze actual information security threats, according to the assessment methodology by the following 7 parameters. The information system register of palliative patients has a low level of initial protection. Based on parameters with a low level of security, as well as the fact that the system doesn't use a secure data communication channel, we can conclude that an actual information security threat is the possibility of interception of protected information by an external perpetrator during its transmission via communication channels. Localization of the identified actual threat is possible by organizing the transfer between the client and the server of exclusively anonymized personal data. The medical record without communication with the patient passport cannot be identified with a specific patient, that it contains anonymized personal data. Anonymization of the patient's passport can be achieved through the use of encryption with local keys. In implementing the scheme described above may be 2 new challenges: an attempt to access the local encryption keys and the encryption algorithms. The first threat can be localized by using user parameters stored on the server as a key, for example, a unique user token, or by storing the key on removable media designed for this purpose only. The second threat can be eliminated through the use of encapsulation code technology, in which access to the source code of the page in the browser will be limited. Technologies for implementing the protection scheme are shown in brackets. As a conclusion, the development of a full-scale information security that implements purpose protection model will allow to offer the system for practical use. Prospects for the further development are creating information system as an electronic hospice based on existing one, or adding telemedicine functionality. Thank you for your attention. If you have some questions about the article or presentation, feel free to send us an email.